Okay, welcome everybody. We're just going to give it a few minutes as usual. Welcome to Breaking Silos and Connecting Care, an integrated approach to hepatitis and mental health. We're just going to give it 1 minute to allow participants to join, and then we will kick off our meeting. Okay, I think the numbers are slowing down. So I think, while I do the little bit of housekeeping and introduction, I think we'll get started. So it gives me great pleasure to be with you this afternoon. My name's Rachel Halford and I'm the president at the World Hepatitis Alliance. And today I have an amazing co-chair, Yves, who is from the Policy and Advocacy Advisor for UGMH, do you want to introduce yourself, Yves?
Thank you, Rachel. Hi, everyone. Good day to everyone joining in from different parts of the globe. My name is Yves. I'm currently based in the Philippines. I'm the Policy and Advocacy Advisor in Health Systems at United, working towards the integration of mental health into the primary healthcare. That includes hepatitis, HIV, TB, and non-communicable diseases. So very much grateful to be here with you today. Thank you, Rachel.
Fantastic. No, thank you, and it's great to have a co-chair. So I think, as Yves has already said, mental health and hepatitis are really closely linked, and they very rarely, in fact, I don't know how often, they affect each other, but they actually very rarely get discussed. So it's such a pleasure to be able to present this webinar to you today and to discuss the links. We will provide you with a little bit of background first. And then we have 4 incredible speakers who are going to share some of their experiences, specifically around mental health and viral hepatitis. We've got a few more questions following their introductions, and then there's an opportunity for you to ask questions. We have got chat in the bottom there, and also the Q&A function will be working. We have, as usual, we've got language interpretation. Could you put the next slide up, please? There. So what you need to do, you'll see it in a minute. There should be a slide that will show you exactly where you need to press, just on the bottom there, and choose the language that you would like to listen in. So we've got English and Spanish today. And just to let everybody know that we are recording this. So it's just for our use, and hopefully, if it's a good webinar, we'll post it on our website. Anyway, I'm sure it will be an incredible webinar. I'm going to hand over to Yves now for the next section.
Thank you, Rachel. I'm also very pleased to highlight 2 key resources from our collaborating organizations, our World Hepatitis Alliance and the United for Global Mental Health. First is the new advocacy briefing on hepatitis and mental health, which was just launched by WHA, and the link will be shared in the chat shortly. Second, we also have a dedicated module on mental health and hepatitis on WHA's e-learning platform, which have been co-developed by the 2 organizations. Again, the link will also be shared in the chat shortly, and we're very pleased to be finally launching this after months of work together. But now let's set the scene for why this conversation really matters. Back to you.
Fantastic, thank you. So I think, there's quite a lot of people here, so we're going to move forward now, and it just gives me absolutely great pleasure to introduce Yves again, as to set the scene, the connection between hepatitis and mental health. So over to you.
Again. Thank you again, Rachel, and pleasure to be discussing this very often overlooked conversation around hepatitis and mental health. So for today, just very briefly, we'll explore how these two areas are connected and why integration really matters, as well as what resources are available out there to help us bridge that gap. So first, talking about the overlooked connection between hepatitis and mental health, for people living with chronic hepatitis B, about 36% actually experience depression and 40% struggle with anxiety. So say in a room of 10, 4 of them would actually experience mental health condition. And with hepatitis C, the burden is even higher, as much as 50% of patients actually face psychological issues, including cognitive difficulties. This shows that hepatitis is not just a liver disease, it also affects the mind, our emotions, and our overall well being. And that relationship actually goes both ways. So, people with depression and anxiety may also be at a higher risk of developing hepatitis as well as reactivating latent infections, as studies show. Furthermore, comorbid depression and anxiety can increase the risk of hepatitis B flare ups by more than 1.18 times. And so the result, um, definitely poor quality of life, as well as worse clinical outcomes and lower treatment adherence. So some of these we want to draw out lessons from our work around integrating mental health into HIV and TB. So this connection isn't actually unique to hepatitis, but we see similar patterns with other communicable diseases such as what I mentioned. So for example, around 62% of people living with HIV have common mental disorder, and common of which is actually depression. So again, imagine a room of 10 people, 6 of them would actually experience a mental health condition, commonly depression. And then with tuberculosis, as many as half of patients actually experience depression. In fact, in one of the stigma studies that have been done by some of our partners, much of which, as much as 50%, are actually face a lot of mental health issue which are drawn by internalized stigma. So as you can see, whether that's TB or HIV, mental health conditions are actually at a higher risk of being developed given these diseases. So much about the picture of what it looks like on the burden side of things. The good news is mental health services are integrated into HIV programs in some of the countries already, and the impact is actually huge. So before, when we were at the early stages of our integration advocacy, we were able to come up with this modeling called the Bending the Curve report, which shows that when we start integrating mental health, it could actually reduce new HIV infections by as much as 10 to 16%. That translates to almost 1 million cases of HIV averted by year 2030. Imagine applying the same integrated approach to hepatitis care. Could you imagine? The potential benefit could be as much as transformative. And so, why do we need to integrate mental health into such care? And what difference can it make? So, first, improved treatment adherence is one of those benefits when we integrate mental health. Depression is one of the biggest barriers to staying on hepatitis C treatment, just as it reduces adherence to HIV treatment by up to 42%. Addressing mental health then directly improves people's ability to stay on medication. Another point is on better health outcomes. Sorry. When mental health is treated, people experience fewer flare ups and faster recovery and improved quality of life. And lastly, this also signals health systems efficiency. When we talk about integrated services, that means there's a reduction of duplication and it can address both the physical as well as the mental health needs in one place. That's what we aim for. In short, integrating mental health into hepatitis program shouldn't be optional. It should be essential for effective care. So on the last part of my presentation, we want to present to you these different useful resources. So thankfully, we don't need to start from scratch. A number of resources are already available. As I mentioned earlier, we are launching an e-learning on mental health and hepatitis in partnership with the World Hepatitis Alliance. And so please feel free to scan the QR code and hopefully you can find the module very useful to your communities and to your groups. On another note, we also co-developed with the Global Fund an e-learning module on mental health and HIV/TB. So please feel free to also access this using the QR code on your screen. And then there's also a handful of other tools that you can find useful when you start advocating for the integration of mental health in your own communities, in your own countries. That includes the WHO Operational Handbook on Managing Mental Disorders in TB programs, in which lessons can be adapted to hepatitis work, and the mental health technical toolbox that we developed as United for Global Mental Health, which provides you fact sheets, annotated bibliographies, case studies, and guidance for integrating mental health into different disease programs. So these tools are designed for policymakers, country level programs, and advocates. And the best thing, they're freely accessible. So at this point, to close, hepatitis and mental health share a strong bidirectional relationship. So if left unaddressed, mental health challenges can worsen hepatitis outcomes. But with integration, we can improve adherence, we can reduce new infection, and most importantly, we can improve and save lives. So I strongly encourage you to please explore the resources that we shared just now and to think about how integration can happen within your own work, within your own context. Thank you very much.
Thank you so much. And I think that was a fantastic way of setting the scene. Absolutely brilliant. And as we move forward, it would be great to hear now from some lived experience. So we've got a selection of speakers, and we're going to ask them to introduce themselves with a little question. So the question is, why do you think it's important to shine the light on the link between viral hepatitis and mental health? And first of all, I'm going to ask Bright Ansah to introduce himself. Bright's a hepatitis patient advocate and storyteller and co-host of the B Heppy podcast by the Hepatitis B Foundation. So I'm going to hand over to you, Bright. If you could maybe introduce yourself with that little question there.
Thank you very much, and good morning, everyone. My name is Bright, as mentioned, and I'm here in the US. So a little disclaimer before I answer the question. I just want to say anything I say or share here is my personal opinion, and I'm not here on behalf of the Hep B Foundation, and neither am I speaking on behalf of all Hep B patients. As we know, all patients suffer from hepatitis B, and there might be some similarities, but also there might be a lot of differences in experiences as everybody journeys through their disease. So just want to make that clear. Why do I think it is important to shine a light on the link between hepatitis B and hepatitis and mental health? For starters, I think a lot of when we have conversation about hepatitis and how it impacts patients, the focus is always on the liver, which is the organ that the hepatitis impacts seriously. And so that's what most of the conversation circles around. We don't stop to look at other ways that the disease impacts the person's life as a whole. So like, how does it impact someone's mentally? How does it impact someone's physically? How does it impact someone's life socially? All those aspects are not covered in a conversation. So I think this makes it really important to shine light So we understand that hepatitis B just doesn't impact the liver, but it goes far beyond the liver. And so when we have conversations to look at other ways and forms that the impact has on someone's life, a patient's life. Another reason why I think it's important to shine light on the link between hepatitis and mental health is hepatitis and mental health are actually among two of the most stigmatized diseases of health issues in our society. There's this shield around these two health issues. And so by shining light, I think it will help break the shield and open and allow us to have an open conversation, which will be able to kind of help researchers even come in and understand and help find solutions, because people struggle and people need help. And in order to get help, we might have an open, candid conversation, so researchers will be able to do their work as well. And then finally, I think it is important to shine light on hepatitis and mental health, because a lot of hepatitis patients suffer in silence and alone. But hearing someone talk about their experience can be a form of support and build camaraderie among patients. Most of the time, because of us suffering alone, you might be going through something, and because you don't know what other patients go through, by hearing someone else talk about their experience living with hepatitis could ring a bell, as maybe you might also be going through it, but you might think, oh, maybe I'm crazy, that's why I'm feeling like this. But hearing someone else talk about their own experience, I think can create a supporting environment, and I think that could help reduce the amount of weight and burden that patients carry. So I think these are some of the important reasons why we need to shine light on these two health issues. Thank you.
Thank you, Bright. Thank you very much for sharing briefly about your work. We now turn over to you, Tung. Tung, why is this connection so important from your work with young people?
Mhm. Thank you so much, Yves. Hi, everyone. My name is Tung, and I'm currently works as Executive Director of Lighthouse Social Enterprise and Community Lead Organization in Vietnam, and also a Senior Advisor at Global Network of Young People Living with HIV. Both organizations are working at the intersections of HIV, hepatitis, and mental health. So our solution come directly from the lived experience of young people, LGBTIQ community, people who use drugs, and also people affected by stigma and also health inequities. Regarding the questions, why is it important to shine light on the link between hepatitis and mental health? I have witnessed many programs attempt to address an infectious disease through a single approach, focusing mainly on clinical services such as like biomedical prevention or treatment, but they have not been effective. In realities, and also as from the earlier presentation from Yves, a hepatitis diagnosis is not only a medical issue, it carries internalized stigma, social stigma, financial burdens, isolations, trauma, and fear. And this deeply affects mental health and resilience. If we don't acknowledge and address this link, people may disengage from care, delay in treatment, or live with unnecessary distress. So I think by shine a light here, we shift from treating the virus only to supporting the whole person. So yeah.
Thank you, Tung. That's amazing and brilliant. The work with younger people too, just fantastic. I'm now going to move over to Sabína. Sabína, sorry, my language isn't working very well today. Sabína is director of Oz, Prima, and Doan. I can't even pronounce it properly. Slovensko. You're from Slovakia.
Yeah. Thank you for the invitation. Hi, everybody. Yes, my name is Sabína, and there is no problem with my name, so it's absolutely okay. So I'm really glad to be here, and yes, I'm a directress of 2 NGOs in Slovakia, in the middle of Europe, in our small country, and we work on a daily basis with people who inject drugs and with people in a street-based sex work. These people or these groups of people, they really often face many health issues, even mental health issues. They face overlapping social problems, economic problems, poverty, and they are all combined and connected. And we cannot somehow lose our sight from all these topics, not only the topic of health, or we cannot separate them. It's not possible. So stigma and the mental health challenge is a really big topic in Slovakia, and the level of stigma is really high, even in the combination of drug use. This topic is not really popular in our country. We always say it's not a sexy topic for the major population. When we talk about person-centered care or person-centered approach, it is very clear to us that the hepatitis and mental health cannot be separated. For example, when there is an individual who is hepatitis B or C positive and needs treatment, but suffers depression or anxiety or stress, the treatment is not accessible for this individual. And it can be way harder to keep up with medical appointments, with treatment, and so on. And this works even vice versa. It means like receiving a hepatitis diagnosis can trigger some worse problems, or it can worsen anxiety, depression, and other bad mental health conditions. So this is why we do work on harm reduction approach, which gives us the low threshold approach, and our care and our support is really personal centered.
Thank you very much for that sharing, Sabína. And now we turn to Benjamin Motuko. If you could also briefly introduce yourself, but also share your views from the Kenyan context. Over to you, Benjamin.
Thank you so much. My name is Benjamin Mutuku from Kenya, LVCT Health. LVCT Health has been working in Kenya for the last 25 years or so. There has been quite a lot of work that has happened around integration of NCDs and mental health and the primary care work that we are doing. However, coming into the question that you have shared, Yves, I would want to say that hepatitis is not just a medical condition. I would want to say that it's a social and emotional one that also carries a lot of stigma, often tied to, times sexual transmission or drug use. It isolates individuals and again also fuels silence. And so at LVCT Health, we have seen firsthand how this silence depends psychological illnesses as well as distress, and discourages people from testing or even seeking treatment. The costs of care are often borne out of pocket, and as well create conditional stress for families already under strain. And so when hepatitis advances to serious conditions like liver cancer, the emotional toll can be quite devastating, often manifesting in depression, anxiety, or even hopelessness. And so by highlighting this link, we totally think it's quite important because hepatitis and mental health, we are actually calling and bringing in people to see the invisible side of the disease. More importantly, we're opening the door for supportive services. Services like counseling, peer support, digital platforms for psychosocial help that will also help to transform patient outcomes and also restore their dignity. Thank you so much, Yves.
Thank you so much again, Benjamin. And thanks to all our panelists for those powerful introductions. If you could indulge me, let's have our deeper conversations as we ask you one by one, especially given your different experiences from your own communities and own countries. Right? If we could begin with you. So, first, how has living with hepatitis B impacted your life as well as your mental health?
Sure. Thank you for the question. So for me personally, physically, hepatitis B uh, has led to, so one of the most significant symptom I experience is chronic fatigue. I've had fatigue. Actually, that's what led to my diagnosis of hepatitis B. Uh, and over the years, that fatigue seems to have gotten worse. And so it limits my ability to do a lot of stuff, like working and stuff like that, which is troublesome. But sometimes you just have to take the punches as they come, as we say. And so physically, that's how it has impacted me. That's the most significant impact it's had on my life. But I also do have some joint issues and muscular problems, which has caused me pain. But as I mentioned, those are not as impactful as the fatigue is. And then with the mental health side of it, so I struggle with depression, and that depression was, I'll probably say, extreme at the beginning. Probably once I was diagnosed, that was a little bit stronger, but over the years, it kind of, I've been able to manage it where it's not that bad. I also do have anxiety and fear, and most of my anxiety and fear is not something I experience daily, but actually it comes around when it's time for me to get my 6-month tests in, like blood work and ultrasound. I do blood work and ultrasound every 6 months, and getting closer to that time frame, that's when my anxiety and fear increases. And why do I have the anxiety and fear? It's because I don't know what, in my head, I know everything is okay, but here I am going to be getting a test. And the problem is this the day they will find something abnormal? You know, uh, even though I don't think about it all the time, it's something that is still in my head. And so anytime I go for a test, it's like, I go through that cycle of thinking about it, like, is this the day that something abnormal happens on my test? And then they say, oh, you have this or you have developed that. So that's, it creates a lot of anxiety and fear. And then additionally, I do worry a lot because personally, I'm not the only one in my family who is impacted by hepatitis B. I have a lot of siblings who have hepatitis B as well. Currently, I'm the only one receiving treatment. They are all back in my home country and they don't receive any treatment. And healthcare is not as well developed and organized in my home country as it is in the West. So all the services that I have access to in the West, they probably won't have access if they need care. And that keeps me awake at night. I worry a lot. Right now, they don't need treatment, but the question becomes, what happens if they need treatment? What would that look like? And how are we going to fund that? And so those are stuff that keeps me worried a lot. And that doesn't help with my mental health either. So those are some of my personal experiences and how hepatitis B has impacted my life physically and mentally.
Thank you, Bright, and thank you for that, that courage to share with us that moment of vulnerability. But also we're curious to know if you could share any of those activities or services that actually helped you as well as your mental health, making sure you can bounce back better.
Sure. So I've done over the years, I've tried like psychotherapy, uh, but it got to a point where I felt like it wasn't cutting it for me, so to say. So I never really did much after that. But there are a few things that I kind of do in my personal life that I found very helpful. So the first thing I did was I tried to understand my own disease. Because I felt like me not understanding the disease created an environment where I panicked a lot of times for no reason, But understanding what having hepatitis B means actually brought me relief because I really understood what the disease is and what it's not. And so it took some of the burden away from me. And so I think it's always important for patients to understand hepatitis B and what it is and what it's not. Because the issue is a lot of time when we get a test that is abnormal, we always, as humans, we jump to the worst conclusion. But sometimes it's not what it is. If you understand the disease, you know that, okay, I have this abnormal test, but that is not the end of everything, And so you prevent yourself from getting in that situation where you panic for no reason. I also do try, I have every summer, I do a little vegetable gardening and I find that helpful. It helps me take my mind off having to sit indoors and just pondering about things that are not helpful. I mean, it gives me the opportunity to focus on something else. And I find it very helpful and therapeutic in that way because you put a seed or you put a little plant in the ground and you nurse it, and the next thing you know, you're picking your own fruit off it. I think that's very fulfilling, and it's something I look forward to doing every summer. I practice a lot of self-affirmations and positive thinking. I'm someone who is naturally very optimistic. I always see the glass as being half full, even when others see it as empty. And I think that has really helped me in my struggle as well. And I consider myself, I don't know if I'm very stubborn. I don't give up easily. So I consider myself as a hybrid between a honey badger and a wolverine. They are very tiny little creatures, but even lions are afraid of these creatures because they don't bow to anybody. And so I have that attitude about how I see life. So something that someone will see and they will be like, oh, I'm done, I give up. I see it and I just smile and keep thinking of what is the next step? How can I move forward about it? So all those things have come handy and I think have helped me in the process.
Thank you so much, Bright, for being so generous in terms of sharing, from self-care and also your journey in terms of learning further your diseases. Because sometimes actually the diagnosis could be a moment of vulnerability, and there's so much uncertainty, which leads to actually increased risk of anxiety, and that's very valid. But also wanted to highlight that in times like this, you're never alone. Make sure you also have support group that you can have with you. I think for last question that we want to share with you, as someone who's a person with lived experiences, as we recognize people with lived experiences are experts by experience. So if you're given the chance, what do you think should integrated services for hepatitis and mental health should look like? Although we know that experiences can be very personal in nature, but what are some of the common threads that we can see could be part of what that integrated service model could look like? Over to you.
Sure. Yeah, so I did ponder on this a little bit, and it's hard to put it into like a picture, create a picture for people to understand, but there are a few things that I think could happen here. One, I think looking at integrating both hepatitis and mental health when it comes to services, I think it can be complementary of each other. So if the patients come to the clinic for hepatitis B or hepatitis care, that is also an opportunity for a mental health specialist to come in and just check on them, see how they are doing and what services are available if they will be interested in that day. They might not be interested that day, but who knows, they might be interested the next day. And if you don't ask and you don't provide, then there's no way they will know. So I think it should be complementary of each other. So patients can save time. If you ask them to go get hepatitis treatment today and come back tomorrow for mental health, they might not be able to come back. But if it's complementary and available during that time frame, maybe they might be able to take opportunity of it and use those services. I think it has to be voluntary. Nobody should feel pressured into having to accept or take part in anything if they don't want to. So that should be a big portion of it. It should be a place that is welcoming and free of judgments. I mean, sometimes we judge by not even knowing we are judging through the things we say. And so we have to use a lot of empathy and sympathize in some instances and show grace as providers or as we try to provide services to help other people. And I also say that it should have a lot of options because I don't think one size fits all. So there should be something that will work for everybody rather than just, let's say, having just psychotherapy. As I find out psychotherapy doesn't work for me, and I bet I will probably not be the only one that find that. I also learned that I don't do well with meditation because my mind is always going like 200 miles an hour. And so I can't concentrate. I can't concentrate on that. So, hey, it might not be something for someone too. So, but I mean, just making it fun and making it lively and respectful. I think it's going to be key, and that might be a lot of promise and be helpful.
Well, before we move on, I just wanted to say thank you, Bright. That was just, do you know, it absolutely warmed my heart. And I hope you could see all the hearts that were coming up the side of the screen when you were speaking, because I'm not an optimist. I'm the opposite to you. And I loved listening to you. But I think that, you know, there will be people that are here that will listening and they'll identify. Their journey won't be the same, but they'll identify. And what it does is it's brave, but it also gives confidence to other people who are able then to speak out. I absolutely love listening to you and identified with so much. Thank you. We're going to move on to, we're going to come back to you in a minute when we've got time for more questions, but we're going to move on to Sabína. Are you still there, Sabína? Yes,
of course.
Hi. We've got a few questions for you as well. So first of all, can I ask you, how does Prima make harm reduction, hepatitis testing and mental health support services accessible to different groups of people?
Of course. So at Prima, we really try to focus on accessibility and trust. These are like really like two keys to understand our clients and to be there for them. There are different entry points how to enter our service. We have a drop-in center. This year, our drop-in center celebrates its 20th birthday. So it's a really big thing for us, especially in terms of Slovakia and our laws here. So there is a drop-in center. People can come without any appointment in the times when we are open. It's anonymous, it's for free, and especially it's a safe space, which is non-judgmental, which is like the most important thing in this all. Really, this drop-in center gives safe space for people who probably don't have the safe space anymore anywhere. So they can exchange syringes, get tested for hepatitis or other STIs, or just come for a talk, for a coffee or tea, or just take some book or borrow some book. They really like to read a lot. We have a multidisciplinary team, which is very important, and we work like in couples. And our services are gender sensitive. It means we have men and women on like during one time in drop-in center. And even we have a medical staff, which is very important because for many people, hospitals or medical centers, they are not accessible or they are afraid to access these services. So we have our own medical staff and even we have our own psychologists. So this is really important. On the other hand, we do provide mobile outreach work. We have our mobile units. So we go directly to people where they live or where they work or do provide the sex work. We even provide the testing and the social and psychological counseling to Roma marginalized communities all over Slovakia. So for us, it's not a problem to go and really travel through the whole country. So we will try like to work with the groups of people on the places where they naturally live. During the outreach, we bring syringes. We do provide the rapid testing. We provide condoms, and also we introduce them the possibility of mental health support, because we have even connections for medical staff, psychiatrists, like in every part of Slovakia where we work. The low threshold approach even gives them, or even, yeah, gives them the possibility to really come in any time for everybody without any health insurance. And everything we do is based on a principle that the access must be as easy as possible. This is really like the most important thing. Then we really try to integrate all our services like on all levels as it's possible. It means when a person comes for a harm reduction material, we use the opportunity to offer the testing, mental health support, or the social assistance, which is really important. Many of our clients, they are not able to visit the doctor by themselves, so they need social assistance. Especially we try to focus on the way how doctors speak with our clients. So there should be no judgment, no stigma. So this is the thing. We are cooperating with the hepatologists and with infectologists on the clinics. So we go and make a connection in advance before we get there with a client, which is very important. For example, during a needle exchange program, we try to ask our clients which opportunity of which medical center is best for them, in what time. So really all the services are tailored to each client personally and individually. Then we really try to tailor the services to each group. It means our services are different for women who work in sex work, because there are mostly women we work with. They even face violence, street violence, sexual violence, and psychological violence, which even influence their mental health really, really much. And many times they face gravidity, which is not expected from their side. So this is even combination of the topic of women's health, or right for health and mental health, and even the combination of the hepatitis or the STIs in general. We don't have services in Slovakia which are only focused for women who are drug users in combination of any STI, or they are mothers and they are even addicted from some substances. So this is really a big challenge for us. So we try to work on with the local ministries and with the local authorities what to do with this issue. And all our work is trying to be community-based. So we really try to understand the community and the needs of community, and really try to avoid this I know everything approach. What is best for you? I know what is best for you. So we really try to provide our services on community base, ask the community what is needed right in that time. And if any other of our services are not needed, we are not stick to them, that we have to provide you something what you even don't need.
Fantastic. And it sounds like, I mean, I think we all know, don't we? Decentralization is so important for a lot of key populations. You know, not everyone can get to a hospital or clinic. And I guess that's, you know, part of why we're here as well, is about talking about integrating. And this is what you're delivering as another way of integrating, by taking services out and decentralizing them, not having them working in silos. But I guess I guess I'd want to ask you though, did you have any challenges or have you experienced challenges in setting up or bringing into your services the mental health services alongside the more traditional services that you're providing?
Of course, first fact I want to mention is that in Slovakia, the treatment for STIs was not accessible for everybody till January 2023. And the treatment was even not accessible for people who were still actively taking drugs till June 2023. So there is a big stigma and big mystery still around the treatment, and we need to educate our clients. There is no biopsy anymore. There is no treatment with side effects anymore. That we have antibiotics which are really, really, really great, and they work really great, and that the treatment is really short and with no side effects. So they still somehow don't believe us, and I absolutely understand them, because if you hear from every doctor, from every medical service for all your life that you will not get the treatment, you are not good enough to get the treatment, you don't pay the health insurance, so you will not get the treatment. Somehow after many years, you will get this, and you will believe that yeah, this is right. So some other clients may say, I'm not worth of to be healthy or to be treated, and so on. On the other side, we have to say that our clients, their basic needs, they are somewhere else. So we have to understand that the basic need is not to treat the hepatitis, because hepatitis it's not painful for really a long time. So if they don't feel the pain right in time, they just think like, okay, it's not a problem at all. So I will deal with it probably later because my basic needs are somewhere else. So, and there is a third thing that really many of our clients, they feel that to ask for a psychological help is a sign of a weakness. So this is really like many things we have to face right now. But I feel that really slowly we are getting to the point where we really like educated our clients as well as it was possible. And the goal was, when we treated the first client, we call him like our patient zero, who was really like well treated. And his experience was really good with the doctor, with the hepatologist. There was no biopsy and so on. And the other clients, they now see that, okay, this one, he's still alive. and his experience is not bad at all. And we were really like by his side through the whole process. This is really, really important, that we were there like at the beginning, and we was working on his motivation to like sit tight and get the treatment and like not go away and just be focused to get healthy. And we were with him like through the whole process. We gave him the psychological support, the social assistance. We motivated him by food, so give him some food support like every month. And like by the end of the treatment, it's very important to focus on avoiding the reinfection. So the part of education, what is coming next after the treatment, is really, really important. And you will not get this in the ambulance of the hepatologist. So there were like many studies in Czech Republic that like 2-3 years ago, they had really many reinfections. They didn't know why. In the group of people who use drugs. And then after they somehow like get to the information that people who were injecting drugs, they used the same syringes and all the things like after the treatment, so they reinfected themselves by themselves. Yeah, I hope I'm clear what I try to explain. So, so this is even really a big part of what we are facing now. So probably this is my answer.
Thank you, Sabina. And that's very clear, actually. And thank you for generously sharing in terms of all the work that you do, making sure that Prima really puts forward an integrated care approach towards better health outcomes. And as you highlighted, help is available. People should realize that they shouldn't be facing it by themselves, but through communities like we can overcome mental health conditions alongside other physical health aspects. So thank you again, Sabina. We now turn over to Tung, Doan, from the Lighthouse Social Enterprise. And perhaps, Tung, you can also take this chance to briefly introduce your organization. So Tung, given your community in Vietnam, how does Lighthouse support young people's mental health in general?
Thank you very much for the questions. Just want to say hi, everybody, again. At Lighthouse, we see mental health as the foundation of overall well-being, especially for young people navigating stigma, discrimination, and violence. Our approach is multi-layer. First, we start by listening to the community. The community knows them best, right? So we collect community voices and also data evidence to design intervention that relevant and meaningful, and implement new peer-led support models, and carry out evidence-based advocacy. Second, we run awareness raising and demand creation campaigns that normalize mental health conversations, helping to break stigma, including internalized stigma, and encouraging health seeking behaviors while also promoting hepatitis and HIV literacy. For example, like within our Prima project, supported by Grand Challenge Canada, we train young people in storytelling and also public narratives, so they could share their experience in empowering way. We love to hear their stories. We also have some art-based therapy section as well, so people just draw about what they are thinking and what is they are carry out. And then based on that, our therapists can help them to navigate and also to learn how to cope with the issues. Another of our core elements is providing peer-led counseling and also safe spaces, both physical and also digital, where young people can openly share their struggle without fears of judgment, learn about how to do self-care for their mental health, also how to be resilient as well is also really important. Many of our peer workers have lived experience themselves. We have, create trust and also have the authentic connections in human way with our community. At the same time, we build linkages to our professional support. We know not everyone needs intensive therapies or mental health support like by the healthcare professional. But when they do, they have a referral pathway to psychologists and also community-based mental health services through our Lighthouse Clinic and also the partner network. For instance, under the Task Force projects supported by Elton John Foundation, we also developed a Rainbow Health Station website, which provides a comprehensive and user-friendly service map with more than 300 health facilities across Vietnam, which allows young people to easily to find mental health, hepatitis, HIV and AIDS, GBV care, and also harm reduction services near their location, near their home, or even when they're traveling around Vietnam, they also can find the information of services in other provinces. Finally, we also focus on advocacy and sustainable financing, as we know about the a budget crisis and funding crisis for not just only HIV, but also for the community services as well. So Lighthouse work closely with our Vietnamese government and also stakeholders in Vietnam to push for more enabling policy and also financial mechanism that guarantee sustainable access and also integration of HIV, hepatitis, and mental health services in Vietnam. So yeah, that is some way that we are working with our community here.
Thanks, Tung. Amazing work there. And indeed, thank you for sharing some of your creative interventions, such as making sure, we build a cadre of young people who are also storytellers, because storytellers make a good advocates or champions within their own communities. So thank you, as well as to Lighthouse, for taking a lead on that. Now we zoom into a more specific topic. How does your community integrate mental health, hepatitis, as well as HIV services?
Well, I heard about the question about the difficulty and challenges, but we also face some similar challenges, like previous speaker. But I will share a little bit about the way that we are doing integration of mental health, hepatitis, and HIV services first. One of our core principles is that health should not be fragmented. When a young person walks through our door or connects with us online, they should not have to navigate like 3 different systems for HIV, for hepatitis, and mental health. We integrate service in 3 ways. At the point of entry, whether some people come for counseling, HIV testing, for PrEP or for hepatitis screening. They are also offered with mental health check-ins or mental health, like screening and counseling. And we believe that every health visit is an opportunity to talk about mental health and mental well-being, and also integrate with HIV and hepatitis. And so offering multiple choices, I also heard people mention about this, is really important. Like I said, that we need to listen to the community and no one size fit all. So offering multiple choices for the community, whether they would like to receive mental health screening after HIV visit, or after hepatitis screening, or maybe before that. It depends on their needs and also their priorities. And either offering is like on-site at our community clinic, or maybe online through our website, whatever is fit for the community is really important. Second pillar, I think, is through the trained peer workers and sensitization training for healthcare professional. So our staff and peer educators are trained not only to provide the information on HIV and hepatitis, but also how to be able to recognize the signs of distress, of mental health disorder, and also how to offer screening and psychosocial initial support and counseling for the community. This makes the service experience holistic, and also people feel care for not just only the virus, but also the whole person. And it's also really important to making sure that the services are friendly with the community. So that's why we have sensitization training for healthcare provider. So offering them the way that they can provide the friendly services to the community, but how to integrate the mental health screening and also initial support for their patient also really important. I actually in Ho Chi Minh City for a mental health training for healthcare professional here. And sometimes we also need to provide the training on self-care for healthcare worker as well, because they also carry a lot of burdens of work. And if they are not healthy, so it means that they cannot provide a very good services to their clients. And I think the third pillars is in program design and also advocacy. We don't treat mental health as an add-on. We embedded is in our models, in our intervention, in our projects. For example, like in our HIV hepatitis awareness campaigns, we also include the message about emotional well-being, how to cope with stress and stigma when living with hepatitis or HIV. In our service map, we not only provide information about the HIV and hepatitis services, but also integrate with mental health service available, and also other services is available for our community as well. And when we advocate for HIV and infectious disease policy, we also share experience, the lived experience with mental health disorder, and also call for psychosocial services as well. And I think by connecting these dots, we make sure that when someone is treated for HIV or hepatitis or mental health, their mental health is not overlooked. And when someone seeks mental health support, they can also be linked to testing, treatment, and prevention services for HIV and hepatitis. This integrated approach is not only improve the health outcomes, but also build trust and also resilience within the community we are serving. So yeah, I think that is some way that we are trying to integrate HIV, hepatitis, and mental health together.
Fantastic. That's such an amazing example of best practice, Tung. And I'm quite interested. So there was a couple of things you said there, and it was really about the language that you use, you know, when you talk about emotional well-being rather than stigma, because I think, you know, we know stigma, hepatitis has stigma, mental health has stigma. So shifting our language so that people feel more comfortable. And I think very much, you know, when Bright was talking earlier about walking into a service and accessing everything, or Sabína was talking about taking it all out. Just, it sounds amazing. And you work with young people, which just blows me away because I just think not enough work is done with young people. But we're going to move on just for a little bit and bring Benjamin back in now and find out a little bit more. Are you there, Benjamin? Yes. Yes. Hi. Sorry, you've been sitting there really quietly. It would be great to hear a bit more about LVCT, you know, as you know, as health advocates for how do you health advocate for support development of holistic approach to healthcare in Kenya? So how do your advocates work, I guess, in LVC?
Thank you. Once again, our experience is LVCT in Kenya, and this, of course, I said we started as actually a local NGO since 2002. And so our experience has actually been that the understanding that health is never one dimension. And so, yes, we started with HIV and we, you know, forged into other different programs. And so we are actually cognizant of that fact that we are dealing with health which does not carry just one pronged kind of response. So hepatitis and mental health, of course, we are agreeing at this level and reiterating that it does not exist in silos. The truth is that these sicknesses, you know, intersect with poverty. They intersect with stigma, the gender inequalities that we see in many countries, the problems in terms of access to care. And so LVCT Health has managed to work in all these different layers. Of course, one of the things that I'll talk about is community presence. And so LVCT has been operating in 36 out of the 47 counties in the country. And we have been building trust through peer educators who are at the community level, youth champions, and this goes to the different facets of aid sets that we get to serve in the different communities, as well as the community health volunteers who are actually the part of the or the lowest level of our health system in the country. These are people who are down in the villages and they are working and living with the people. And so they normalize the conversations about both physical health, which would at this point therefore carry hepatitis, but also around mental health. So we have community presence, and we've tried to work on that. The second bit is around integrated services. One of the things that we have been saying, and I think it's worth carrying, is that a lot of times we may not need to reinvent the wheel. It's important for us to realize that we can actually integrate, and I think the speakers before me have actually talked about that. You don't need to build a whole new system. Integrate, these services, the screening into the existing HIV and sexual reproductive health programs. And so out of this, we are actually screening for hepatitis as well as mental health challenges. Therefore, of course, ensuring that people don't fall through the cracks. And so we are making sure that this is also done at the lowest level. as we've also gone into digital innovation, and a part of one of our programs, which is a one-to-one. It's 1, then 2 is a digit, and then 1. Kenya website. We have quite a digital platform there, which was purely designed for young people, but as well has served many other people, because in it we have a toll-free line. We have the website being quite informational, as well as, it's also hosting different mobile apps, who also provide platforms for counseling, but also information sharing, so that on prevention, there is sufficient information, on testing, there is sufficient information, all the way to treatment, referrals, and meeting people where they are. One of our interesting things around our toll-free line that people can actually call for support is that it's actually connected to geo mapping, so that if someone calls our toll-free line, it's possible for us to see where that person is, where they are calling from. It's possible for us to see the closest government facility for them to get support, and so we're able to refer them there. If they are willing. There are some who actually don't want to go to the closest place because they would feel like they are known around that area. So again, you tell them the options that they have. And then there's also policy advocacy. We push the universal health coverage packages that include hepatitis and mental health issues, often left out on the margins. And this is in the different levels, both in research, both in practice, as well as in policy, and then capacity building. We believe that if we train healthcare providers to recognize the psychosocial, psychological burden of chronic conditions, equipping them to treat people, not just the diseases, we believe that this actually enhances the kind of holistic model that we are looking at. And so, yeah, we are combining prevention, we are combining treatment, emotional support, and as well policy reform into one coherent approach.
Wow. I mean, really impressive and just incredible. And I think we all, in terms of social media and digital, we all have to be and are using that more, aren't we? I just wondered, though, you touched on it there around policy. I wonder if you could tell us how LVCT Health is supporting the Kenyan government, health ministers, to write their policies, and whether you're managing to get the government to integrate hepatitis and mental health in their policies moving forward.
Great. LVCT Health uses an approach that we call RPP, and I'm sure probably most of us are aware of it, which is ideally research, policy, and practice. And so this model ensures that every policy we help shape is informed by both evidence and lived experiences. And so LVCT, of course, therefore brings lessons from pilot projects, community programs, and digital innovations into technical working groups at both the national level as well as the county levels. And so we are approaching both policies at those different levels is important. And so we contribute to NASCOP, viral hepatitis, which is also looked together with STIs and mental health TWGs. We are ensuring that the voices of different TWGs are heard, as well as people who are living with these conditions. We make sure that they're actually getting to influence the policies in those directions. And so we support them into those TWGs, the technical working groups at those different levels, and make sure that their voices are heard so that they are actually incorporated in the policies being developed. We've also supported the ministry in embedding mental health screening and referral protocols into existing HIV and SRH programs, demonstrating the integration that, this is possible and it's actually effective. And so we have gone again at the different levels, the county level, which is taking us all the way down into primary care, and also supporting healthcare providers to actually be able to incorporate all these things in their work. And then we also generate data on stigma. We generate data on service uptake and health outcomes, which helps the ministry identify gaps and as well design more inclusive guidelines. And so ideally, we are supporting at all those different levels, including now bringing in programs that are working to support the government in these efforts. Looking ahead, we see that Kenya's integrated guideline on HIV, on STIs and viral hepatitis, coming together because we've actually been working towards advocating for an outcome out of this advocacy. And so we've been actually working around advocacy around this. And so our influence goes beyond those documents because we also support the counties to implement these guidelines. And so, yes, we have seen a lot of integration happening this far. We have been part of supporting the implementation. And of course, we believe that there is more that needs to be done. And of course, we are set and working on it. And so, yes and no, I would say that we are already working on these different documents. We've worked on mental health integration into primary care. We have worked on hepatitis integration into the healthcare system. However, bringing all of them under one umbrella is the work which is ongoing at this point. And I'm sure that it's going to be great for us to see some of the lessons that we get out of it. So yeah, I think I have been able to respond. If you have more questions, I'll be willing to chip in as well.
I think fantastic answer. And do you know what? I don't know. I mean, we've got an opportunity now for the audience to ask questions, but I don't know of anywhere that's got it sorted yet. So, it sounds like the work that you've done in integrating it in terms of policies or getting there, and maybe as Tung was saying, there's a lot of work that's getting there in India, but is in Vietnam, sorry, but has anybody got there yet in terms of integration? That's the thing, I think. But we have this opportunity now for anyone in the audience to put your hand up, ask a question. You can ask your question to anybody, any of the panelists here. I actually can't see the hand, so I'm reliant on Ben or Alex, the WHA team, to let us know if anyone's got their hand up. I think in between, if you're not comfortable, there's a Q&A box. There are a couple of questions in there. I'm not sure. My question is, in area of need assessment in project implementation of hepatitis and mental health, how will the project assess and address the social determinants of health that impact this population? I'm not sure whether, Benjamin, whether that's something that you guys include in your the work that you're doing. Do you look at the social determinants of the health that impact the population? Or does anybody?
All right. I would say that we have quite a robust monitoring and evaluation kind of system, which is looking at both qualitative and quantitative, insights around integration. But then again, I would still say that working on stigma around the communities and all that is quite some work that still needs to be done. And so I think we still have a long way to go. But yes, we actually have had studies that have been looking at those social determinants. Most of them have been quite qualitative. And I was just trying to pull one of them when I started speaking. And if I get it, I think it is going to be great for me to bring it just out for us to look at it. Yeah.
Fantastic, thank you. We have actually got one question in the chat from Chester. Hi, Chester. I hope you're well. I guess a question to everybody then. How can community engagement strategies be designed to effectively raise awareness about the intersection between mental health and hepatitis and promote integrated services that address both conditions in a person-centered way? I'm going to open that up for all of you. I'm just going to put my mic off and then you go for it.
I can go first actually for the
Yeah.
first question. Yeah, similar. We're trying to also collect not just only quantitative data, but also qualitative data to collect the story and lived experience from the community. But also trying to disaggregate the data, not just only about the HIV or hepatitis or mental health condition, but also the incomes, also the living conditions and how to access to those social protection services. So that is the way that we are doing, trying to making sure that we can collect also the social determinants that affects or influence people. In Vietnam, we also implement the community lead monitoring as the regular community feedback for the services and for the information. I think it's also fit with this question as well. It's really important to listen to the community and also engage community in design the campaign or any other kind of activities, and making sure that it's relevant and also fit with the community culture and context. And we're also trying to harmonize the contents of the campaign, because it's really mentioned about community engagement and also campaigning. So making sure that we have the representations of not just only people living with HIV or hepatitis, but also people living with mental health condition, to really understand what is the influence factors that we may bring to our activities, and making sure that they have space to speak about their own experiences and also ideas for the activities. And regular measure like collect the inputs and feedback for the activity also really important. We sometimes just engage them in the beginnings of the design of the project, but making sure that we also engage them in the implementation, also monitoring evaluation of the project, also really important to making sure that it's relevant to the community and achieve the highest impact on the community.
Yeah, just to add to what Tung just said, I think it's really important to engage the community and have the community voice represented. And I think one way to do that is by using patient stories. I mean, those are effective tools, especially I have seen it being used effectively in raising awareness in the community here in the US, where I've gone to the community and shared my personal story in a community screening event. And it's always one thing to hear about the number of people who are impacted by hepatitis B, but to put a face or see someone who live with a disease, I think creates a lasting impact that never leave the person's head. You never forget about someone's story, but you might forget about a number that is thrown at you. So I think it's engaging the community and getting the community involved. As Rachel said earlier on, the community members, we should treat them as experts. They are the ones living through the condition, and so they know what works and what doesn't work. So if you don't engage them and you just decide, okay, I'm just going to sit at the office and create this to help them, you might end up finding out that, oh, it doesn't work. But if you have consulted with them, they would have told you what works and what doesn't work. So treating them as experts and using their stories, I think it's one way to effectively raise awareness about the intersection of mental health and hepatitis.
Brilliantly said, Brian. And I think that we heard a couple of people talk about it. So I think Benjamin did, Tung did. You know, they use the word normalize the conversation. And the only way you normalize the conversation, I believe, is through lived experience. You know, it is because exactly as you say, Brian, it puts a face, you know, it becomes a real person rather than a number. and I'm a huge advocate for peer support. I think, and I think in every one of your presentations, you all mention peer support, but it's pivotal, particularly when you're talking about integration of hepatitis and mental health, because both have such huge stigma, and the intersectionality between the two, it's kind of, why have we not had this discussion before? Why weren't we discussing this 5 years ago? Because it's always been there. It's just that we've never got to the point where we've had the discussion. I don't know how it is for you at Unite, Ives, having this discussion, and how long have you been involved, or why hasn't it happened sooner than it is now?
I agree. Thank you, Rachel, for those insights. And I think one of the things that we also highlight, good to highlight, is that we should be the one carving out spaces for people with lived experience. If governments or existing platforms do not offer such, then let's make a space for them. Let's disrupt that space, because stories are so powerful that they can actually move mountains. And those are the very stories that actually has enabled, for example, policy reforms, budget line items dedicated to mental health and hepatitis. And so thank you to all our panelists for actually sharing and being aligned in terms of how live experience can actually be not just an expertise, but a source of strength and power to turbocharge our advocacy.
So we have a little bit more time left, and rather than me sit here, I keep saying, sorry, I've got no background, by the way. I feel very plain and undressed without my nice background, but it's not about me. While we have a few minutes left, I just wondered if there's anything that any of you on the panel, one more thing that you might want to say to the audience that they can take away with them regarding mental health, hepatitis, integrating it, any ideas? Sabína.
Yes, maybe just a few last words from my side about the people with lived experience. It's really important, not just to join them to policy making decisions and to connect them with the local authorities. It's one side of the thing. But on the other hand, from my experience as a vice president of Patients' Rights Association, now I experience that really like the voice of a patient's organization under some association is much more louder than a voice of an individual or some individuals who try to fight for their rights. So really we should even support people with lived experience to join these organizations and to create patients organizations which can be like really much louder and much more visible.
Fantastic, thank you. Bright, any last words from you?
Yeah, I think there is a question in one of the last Q&A that came in, and it has to do with someone asked a question about how to go about a situation where you have a patient who has access to treatment, hepatitis B treatment, but because of anxiety and depression, they are refusing treatment. I think it's a complex issue. But I think probably the first thing to do is to understand where the anxiety and what is the source of the anxiety and depression. Is it them being on the medication? Because we know a lot of patients who take Hep B medication probably have to take it for the rest of their lives until there is a cure. Is that what is creating the anxiety? Is it cost issue that is creating the anxiety? Because some areas this medication is not readily accessible. They might have it for this month, but next month they might not be able to. So understand what is causing the anxiety and the depression, and also acknowledge that, yes, you acknowledge that these things are normal experiences that patients do go through from time to time, and just educate them about the lack of action and what the consequences could be for their liver if this goes on for a long time. Because I think a lot of patients, there are patients who say, well, I know there is, I need to take this medication now, but I want to wait until there is a cure. Well, I always throw it back to them. It's like, well, while you wait, your liver might be damaged. and by the time the cure comes, you might probably not be around to take that cure. So give them the option to understand that, yes, you have this decision you are making right now might have a huge impact in the future. And so just letting them understand the risk, I think sometimes helps them. And that's the key. I always mention that it's always good for the patient to understand their disease. And so if you understand the disease and you understand the danger that is associated with the disease, especially when it comes to developing of liver cancer or liver failure, due to lack of inaction, I think a lot of patients will understand that. And I always say the alternative is always worse. So provide that and draw a clear link to what could happen if they don't proceed with the treatment. And so I think those are things that you can do, sit down and have a conversation, real human to human, face-to-face conversation, understand and also acknowledge, and come from a place of respect. You want to understand so you can help. Don't be like, I'm the boss, I know, that just be human. I always tell people my policy is if you are in a space and you work with humans, just treat people the way you want to be treated. It's just as simple as that. If you understand that, I think you can win over a lot of people. So.
Fantastic. Wise words. Thank you. Any quick last words from you, Tung?
Yeah, so I think it's really interesting conversations, and I just take this from WHA. Hepatitis cannot wait, and we should not wait. Is it a time for us to work together? I think everyone has role to play. Community, academia, and also governments and NGOs and donors and funders. We should work together and also invest in the community initiative. So that is my last words. Thank you.
Fantastic. Benjamin, any last words from you before I hand it back to Yves?
I think for me, it's just thinking around where we start. And my thoughts would be actually around start with co-creation, not top-down kind of campaigns. I mean, we make it a true partnership where you get people living with hepatitis, those with lived experiences of mental health challenges, marginalized groups. You're bringing all of them together and let them shape the language of engagement, the imagery, as well as the messages. And then you could also use the trusted voices in the communities, use peer educators, youth champions, leaders in religious circles, local influencers, media influencers, and all that, so that they also bring in light. And then we go all the way to bringing the services at the local people, so that at least if people do not have such services, you're also supporting them, through outreach clinics, mobile testing, health camps, all these combining hepatitis screening with mental health assessments and basic counseling. And then let's build also safe spaces. And as we build safe spaces, we need to be safe spaces ourselves. I think that is where it gets to begin. And so, we build support groups where face-to-face or online, whichever way. I think the important thing is for us to keep providing ongoing psychosocial support, as well as, human stories, sharing human stories, not just medical statistics out there. Share real stories of human, and I appreciate our brother who is here as a lived experience. And then engagement is not, the kind of thing that we are seeing as a top-down kind of approach. I think we need to make it a partnership, and a partnership that is substantial. Thank you so much, and I appreciate the opportunity.
Thank you, Benjamin. As we close, I want to again sincerely thank all our panelists for your valuable contributions. We also extend our thanks to WHA for having this platform for everyone. So just one call to action from my end. Please do remember to check out the first new advocacy briefing and second, the WHA e-learning module on hepatitis and mental health. Both links are in the chat. And so these are resources in order designed to help us advocates to push for integrated care. Again, thank you everyone. This is Yves from United for Global Mental Health. Back to Rachel.
Well, and thank you for being here and sharing. So I just want to echo and say thank you to all the speakers. It's just been such, I hope that you as the audience, I thank you for joining us, and I hope that you enjoyed what hopefully will be a beginning of many webinars on mental health and viral hepatitis. Let's bring them all together. Let's integrate. Thank you so much for joining us. If you would have time, there's a survey. If you could just complete the survey that's in the chat, we'd be much appreciate that. But I wish you all a good morning, good afternoon, or good evening. And thank you so much for joining us. And we look forward to seeing you again soon. Thank you.
Thank you so much.
Bye-bye.